Hey there, my name is Autumn and I'm a nurse at Floyd Medical Center and I'm your spine coordinator. I'm going to take a few moments to go over your pre-op education to help prepare you for your upcoming spine surgery. All of the patients that are signed up for spine surgery at Floyd should have received a guidebook from the physician's office. These books are designed to give you a step-by-step instruction to your upcoming surgery. There's one for cervical patients and there's one for lumbar patients. If you did not receive one of these books, please let your nurse know the day of surgery so that we can make sure you get one prior to discharge. Patients that are booked for spine surgery at Floyd are going to be going through several steps. We're going to go through those steps now and make sure that you have a good understanding of what your expectations are. Patients that are having spine surgery at Floyd and go through this program are going to be spending the night at the hospital at least 1 to 2 nights after your surgery. Patients will need to bring with you your incentive spirometer that you received at the pet clinic. You'll need to bring a change of clothes and any other items that might make you feel comfortable, such as a cell phone charger or your own pillow. The day of your surgery, you're going to check in at the main lobby at Floyd Medical Center. You'll go through our screening process and be taken over to the surgical area. You're allowed to have a visitor come with you, and that visitor will remain in the surgical waiting area while you're in surgery. The family member that waits with you will get updated by your surgeon after the surgery is over on how things went during the case. Once surgery is over, our patients move over to the recovery room and then will be admitted to the spine unit on the 4th floor. Once our patients arrive at the spine unit on the 4th floor, they're going to be getting a lot of things from their nurse. So we're going to go ahead and go over those to help prep you and make sure that you understand. Patients that get admitted to the spine unit will be checked in by their nurse and an admission assessment will be completed. The nurses will go over your medications as well as your post-op orders. Patients that have neck surgery may or may not receive a collar after surgery. These collars are referred to as a soft collar or a hard cervical collar. The collar that I'm showing you here is referred to as a cervical aspen collar. These collars aid in stability, and you're going to be required to wear these collars while you're healing from your spine surgery. The therapist and the nurses will go over how to wear the collars and make sure that the fit is appropriate for you. They are adjustable as well as come with an extra set of pads so that you can change them out as they get soiled. Patients that have an order for this collar are typically going to wear the collar for a minimum of 4 weeks. The soft collar is a little bit less invasive and is only to be worn for comfort. We have both of these collars readily available to our spine patients, and we will go over education with you at the time of your surgery. Patients that went through the pre-op evaluation clinic prior to your surgery may have been given an incentive spirometer. This is what it looks like. If you did not go to the pre-op clinic, you'll be given an incentive spirometer once you arrive on the spine unit. This device is to be used to prevent any kind of pneumonia or bacteria from forming in your lungs from surgery. Patients are at risk for pneumonia following anesthesia and being put to sleep. You'll use this device while in the hospital, and you'll also use it when you go home to prevent any pneumonia. The nurse and the respiratory therapist will educate you on how to use this device and how often you should be using it. Other things that you may have brought into your room after spine surgery include a pulse ox monitor that will go on your finger, and it will monitor your heart rate and your oxygen level to ensure that you're safe after surgery. Patients will also be hooked up to a device that we call SCDs. These are a wrap that's going to go around your legs, and it connects to a pump that helps circulate blood after surgery to prevent blood clots. These devices need to be hooked up anytime that you're in the bed for an extended period of time. Another device that you may find yourself with after spine surgery is called a surgical drain. Some of our patients have a drain to help pull excess blood away from their incision. This drain will remain in until the output has slowed and the surgeon gives the nurse an order to pull it out. All of the drains are discontinued prior to discharge, so it's nothing that you'll need to worry about managing while you're at home. The nurses will record the output of the drain throughout their shift and report it to your surgeon. The drain is also there to help prevent any kind of hematoma from developing, so they're an important part to your post-op recovery. Patients that have the drain will need to make sure when they're turning in the bed and getting up that the drain does not get disconnected. And if something was to happen with the drain, you would need to notify your nurse. Some of our patients after surgery require a Foley catheter. If you have a Foley catheter after surgery, the nurses are able to pull this catheter as soon as you are safe to get up and be able to go to the restroom. The Foley catheter will automatically be removed the following morning after your surgery if it's not approved to be pulled earlier. Making sure that you're able to void is a big step after surgery and a requirement before you're able to be discharged home. Now let's talk about your food. Patients that have spine surgery are going to be started off with a clear liquid diet. After anesthesia and being put to sleep, our intestines are very slow to wake back up. For this reason, patients are started off with clear liquids, broth, jello, popsicles, anything you like to drink, but we will hold regular food until you have passed gas. Passing gas is the best way to know that your intestines have woken back up and are ready to digest regular food. Once you've passed gas, please notify your nurse so that they can advance your diet and get you started on regular food. Patients with neck surgery can sometimes have difficulty swallowing after surgery. This is normal and can last anywhere from 48 to 72 hours. For this reason, some of our neck patients need to be on a softer diet to prevent choking. This will be assessed by your nurse and your surgeon, and the appropriate diet will be ordered for you. So let's talk about your post-op pain management. Patients that have spine surgery are going to experience pain after surgery. We have a multimodal pain management system in place to appropriately treat patients' pain levels. Medication will be available to you immediately after surgery. Medication can come in several different forms. We do prescribe our patients pain medicine via pills or via IV medicine. The IV medication is very quick acting, but it is only available to you for 24 hours. After that 24-hour mark, the IV medicine is discontinued. The surgeons order it this way because we cannot send patients home with IV medicine. We want you to attempt to take the PO pain pills first. The pain pills is what's going to be prescribed to you at discharge. We want to make sure while you're in the hospital with us that those pain pills are effective at managing your pain. Another option for pain control after spine surgery are muscle relaxers. All of our patients have a muscle relaxer ordered as well. These medications can help with muscle spasms or tightness that you may have around your incision. The muscle spasms can be treated by this muscle relaxer and sometimes are more effective than the pain medication itself. These are all important options that you have to help with your pain after surgery. Please remember a few key points. We cannot make you 100% pain-free after surgery. You're going to have some incisional pain simply from where the surgery took place. Our goal is to keep you as comfortable as we safely can and allow you to be able to get up and move and participate with therapy. The number one side effect of all of this pain medication is constipation, so you will be offered stool softeners while you're in the hospital to help prevent constipation from occurring. Another thing to note is that these medications are ordered as needed, which means that you as the patient will need to request the pain medication from your nurse. Please don't automatically assume that you're getting the medicine unless you're communicating with your nurse. It will be brought down to you as soon as you can have it, and we have to make sure that you're safe to receive the pain medication, such as obtaining your vital signs and making sure that you're not too drowsy. These are all things that go into play with pain management after spine surgery. Let's talk about discharge. There are several things that have to happen prior to you being discharged from the hospital to go home. We have a checklist that we go through to make sure that spine patients are ready to be home and recover safely from your spine surgery. This checklist includes physical therapy. All of our spine patients that undergo surgery will have to receive a physical therapy evaluation. The therapists are a huge part to our team and ensure that you're safe to go home. Therapists are going to be able to walk with you, go over your activity restrictions, they'll do stairs with you. They do a lot of education for us after spine surgery. Once you have cleared physical therapy and they feel that you're safe, that's a big hurdle to getting our patients home. Another thing that has to happen for you to be able to be discharged is that your pain has to be reasonably controlled. As mentioned earlier, you may not be pain-free, but we want to make sure that it's controlled enough for you to get up and move around while you're recovering at home. Once that has been achieved, that's another checklist to get you discharged. A third thing that has to happen is that you do have to be able to pass gas after surgery. This ensures that we're able to advance your diet and make sure that you don't have any discomfort with eating. This is also important for our cervical patients who need to make sure they can swallow soft foods to be able to be discharged. Those are things that we check for to make sure that they're occurring prior to sending our patients home. While most patients are able to be discharged the very next day after surgery, some do require a little bit of a longer stay. If you're slow to progress with physical therapy, we do have a rehab program at Floyd that's a great option for patients that need a little bit more work with physical therapy. Again, thank you for choosing Floyd to have your spine surgery. We want you to be successful, and we're here to help you every step of the way. We'll provide you with contact information so that you can call and go over any information you need when you're discharged. Thank you, and we hope nothing but the best.